if you want to call it a disease, I think obesity is probably the #1 disease I see in dogs.
Okay, so I've got a list of myths.
Okay,
So I've got
more
them here.
myths.
I'm gonna just shoot them out and you tell me true or false.
Okay.
Hi, y'all. Welcome to Buddies Besties. I'm Layla. I'm your host today, and I'm joined today with Dr. Meg Pope. Thank you for coming.
You're welcome.
You brought a couple friends, which I love. So this is Scout. It's my new friend. And somewhere around here is Ava.
She's right back behind.
So she may or may not be wandering in. So if you see them, those are our friends today.
They are brother and sister.
They are brother and sister. Oh,
Yeah.
that's so cute. I love it. I love it so much. That's great. So let's talk first a little bit about how long you've been a vet, where you went to school, all that kind of fun stuff.
It's been a while now. I'm 37 years into the practice.
Wow.
Yeah.
Always here in the DFW area.
Yes.
Okay, great.
Yeah.
And you went to school?
I went to Texas A&M University for
Okay.
my undergrad years. And then I was accepted into veterinary school. And veterinary school is a full 4 years.
Okay.
You start with the same people all through so you get really close with your classmates. Went to school with some of the most amazing people in the world. They're just brilliant. And my class was the first class that was 50% women.
Wow.
Mhm.
And now,
Women have taken over, and it's about 90% women that are accepted into veterinary school. I would actually love to see that shift back to more balance.
sure.
Because some of the men we went to school with, they were just geniuses, and I think we should be recruiting males back to the profession as well.
Do you think there's a reason why women gravitate more towards being a veterinary?
I don't know. I think it just became very, very popular.
Mhm.
And I think a lot of the guys ended up thinking I can work that hard and be a doctor and make a little bit better wage.
Got it.
I mean, it's a good living, but it's a lot of work. And,
Yeah.
I don't know. I think just tended to get, and the student debt is big.
Sure.
Tends to be.
Yeah. I think if it were me, I would much rather work with animals. So I'm all about everything I can do with the animals. So I think it's great that you decided to do that. And thank you for joining us today, because we have lots and lots of questions here. But I want to start with something. Really about how we come to you. So is there a way? My cats get super stressed out when I'm coming to the vet. They really don't. And I know some dogs like to be in the car and some don't. So what are some things we can do at home to help it make it be less stressful
I
for
love
them?
this question. Because it is presumptuous of us as pet owners to think our pets, especially our cats, are going to just be okay with getting shoved into a crate and going in a car and getting pulled out of that crate and vaccinated and things, and that not being stressful.
Right.
So I think some things you can do is don't put the crate away.
Okay.
Keep the crate out, throw treats in it. The crate doesn't mean I'm going to the vet all the time. Make it a happy place. Put a little blankie in there. Throw your favorite. We were talking about treats earlier.
Yeah.
I don't know if you've ever tried Temptations. I don't know if it's healthy treat or not, but I know every cat loves them. And just
Okay.
put some Temptations in there. Feed the cat in there. Put toys in there, and let them get accustomed to having that crate out, so that when you pull that crate out, that's not automatically,
Yeah.
I'm going to the vet or I'm going to a groomer or something else bad. And also adjust them to the car rides.
Okay.
Cats are typically not crazy about the car. So take them on little bitty short rides over and over. Don't
Okay.
expect them to be happy with an occasional car ride. Let them get used to that.
Normalize it.
Mhm.
Okay.
Handle their feet, handle their ears, handle their body, turn them over. Do things that the vet's going to do.
So they get kind of used to it.
And give them treats as you're doing it, and tell them
Okay.
what a good boy they are and good kitty.
I love it.
Same thing for your dog. If your dog is not leash trained, the first time they ever get a leash on them and is to drag them over to the vet, it's never a good combination.
Not going to be fun.
If they don't like car rides, try to get them acclimated to the car. It might mean getting some medication before the vet, and
Okay.
also for your kitties. We do have nowadays, we're using a lot more pre-vet visit drugs,
Okay.
medications, to relax those cats before. We call some cats are spicy.
Yes.
And a lot of times we'll wrap them in a towel, and those are spicy burritos. And so when we give them the medication, they just turn into regular burritos instead of spicy burritos.
Regular burritos.
Yeah.
What about the things you can get over the counter, like the CBD gummy things that are for pets? Are those okay to give them? Do they actually calm them?
Fine. I have had people swear by them. I don't know that there's any research. Actually, I know calming treats. I think those help. I've had people say the CBD, try them. I don't think they're going to hurt anything.
What about those calming things that you can plug into the wall? Have you seen those that
The
are?
Feelaways?
Yes.
Those are good.
Okay,
The
so
pheromones.
that could work too.
Those are pheromones.
And I've seen that in wipes. You can wipe the inside of the crate with
Yes,
that. I did that to
yes.
fly with my cat once, and I did that.
And it's a little spray as well. We'll spray a cat cage. We'll spray it, and before we put a cat in it, because it does seem like then they'll mark it, and I'm not sure exactly how it works, but it does work.
Okay. What are some of the common diseases that you see with your animals, and are any of them avoidable or preventable?
Well, diabetes is thankfully not super common, very preventable. We've talked about diet and overfeeding, which I guess if you want to call it a disease, I think obesity is probably the number one disease I see in dogs. I think I would guess at least 50% of my patients are overweight.
And that leads to other illnesses.
It does. It leads arthritis, diabetes. If they get a tumor, it's much harder to find, so you're not going to find it until it's advanced. Just overall well-being. And we did talk about food, and Purina, for example, all they want to do is sell dog food, right? The more they sell, the better. They did a study with Labrador retrievers that were all related, and I think there were 40 dogs. I don't remember. They took they had them in separate groups. One group, they fed all they wanted for a certain amount of time. Then this group, they did, I think, 15% less, maybe 20. Anyway, less. They follow these dogs for their whole lives. The less group lived 1.8 years longer. That's a lot in dog life.
That's a lot
the
in
difference
dog life.
between 12 and 14 or 13 and 15. And that's labs. If you think about a smaller dog that can live, that might be the difference between 18 and 20, and we all want our dogs to live longer. So I think was a very important study.
I think that's a common trait with all pet parents is however long you have them, it's never long enough.
It's never long enough.
I had a cat for 22 years and I would have begged for 5 more minutes.
Yeah.
So it's never long enough. And so obesity is the number one thing you're saying. So
I think so.
And what you feed them, maybe a little bit less important is more of how you feed them and how much they're getting. Interesting. What about things like flea and tick? So we talk about in the cat world, it's Revolution. I think it's actually Revolution. I think it's the same brand medication. There's Revolution, there's Prevention, there's tons of brands, right? So brand agnostic, how important is it to have flea and tick medication on your dogs, on your cats, inside animal versus outside animal?
Great question. Well, fleas and ticks especially fleas, are super happy inside, outside. They're happy everywhere they go. So just because your cat or dog is inside doesn't mean they're not going to have fleas. And I have people that say, "But my cat's inside; they don't have fleas."
Right?
They do, and they go, "Well, I don't get them on me." Well, they prefer
the furry guys.
These are the preferred hosts.
Correct.
So just because you don't have them biting you doesn't mean you don't have them. And it depends on where you live. Where I live, I'm a little bit farther west. It's a little bit drier. I don't see a lot of fleas and ticks. Everywhere farther east, and these beautiful, lush St. Augustine grasses with sprinkler systems, those fleas are happy, happy, happy. We have more of a problem with ticks, though. And I think ticks are more dangerous. They carry more diseases. They carry all their tick-borne diseases, your Ehrlichia, your Lyme's disease, Rocky Mountain spotted fever, anaplasmosis. There's a long list.
All those things. And I know with cats, mosquitoes are a big problem because they can pass lots of bad things to your cats, and they can get in your house. So even if your cat's an inside cat, they still can get in.
Right.
And so doing that every single month, especially in areas that have lots of mosquitoes. So if you see them, they're there.
Right.
And you just never know.
And of course, mosquitoes carry heartworm disease.
And heartworm, now we're going to get into this later. I have a bunch of myths. I asked people, give me some myths, and we're going to have Dr. Meg bust them. So a myth is you cannot cure heartworm disease. Is that a myth or is that fact?
That is a myth. That is, we do cure that.
You can
disease.
cure that.
Mm-hmm.
So if your cat or your dog gets heartworm, it's not necessarily the end of the road.
It's not. It's actually way more dangerous for cats than dogs. We don't see it very often in cats. But if a cat gets heartworm disease, it's really serious. Dogs, we treat them all the time.
Okay. So myth busted.
Yes.
Myth number 1. I have a whole list of them. We're going to get to those in a second. What are some medications, new medications or things that are coming on board for animals that we may or may not have heard of yet that are some exciting things that are helping treat?
I have a couple that are really exciting.
Okay.
One is called Solensia. And I mentioned, you said you had a 22-year-old at one point. My cat's 20. It's a once-a-month injectable for arthritis.
Oh, wow.
My cat is the sweetest cat in the world. He's the worst patient. The last thing I would want to do is give him medicine every day. But giving him a shot once a month is pretty easy. And that little spindly little 20-year-old cat can jump up onto all the ledges.
Wow.
It's unbelievable. I'm super excited to have that drug. Since he jumps better, he feels better, he eats better.
That's great.
Because he's real skinny. And so it's really helped him a lot. And now they have the dog version. It's called Librela.
Okay.
And so it blocks nerve pain at the nerve endings, which is a really nice thing to do because it's all over their body. They feel better.
That's great.
Super exciting.
Wow, that's exciting.
We also have for our diabetic cats now, not all cats are candidates, or not all diabetic cats are candidates, but we have a daily pill instead of having to give an injection of insulin every day.
Oh, wow.
That's a biggie.
And a lot of times with pilling animals, it's just so hard, and every animal's different. Especially a cat. I've learned. My cat had kidney disease for almost 3 years, and pilling him was an adventure.
Yes.
And once you get the trick down, they change their mind. So that treat or that way that you were doing it, and I mean, I was doing every trick in the book. I had it in the pill pocket, I'd roll it in tuna water, and then I'd roll it in the tuna flakes. That worked for about a month, and then we were on to I don't want that anymore. I figured out there's medicine in there, so I'm going to get something else. Yes. So we learned all kinds of tricks. But what kind of medications cross over, like from a human medication?
So many,
right?
Yes,
but then there's some that are very dangerous. So how would someone know because I had someone tell me, oh, my dog has allergies, so I give it Benadryl. And I'm like, I'm not sure.
Do that.
You can do that.
It's not very successful.
Okay.
But you can do it.
You can do it.
Never, ever, ever, please, no one ever give your cat a Tylenol. It will kill your cat.
Wow. Okay.
And another thing, it's not a medication, but sugar-free gum that has xylitol will kill your dog.
But not your cat.
Because
there are things I know that dogs don't do chocolate very well.
Right.
But
dose dependent.
But cats can't do.
Probably can't do chocolate.
Onions,
it's just
poinsettias.
Cats are so picky that you don't have to worry about them eating xylitol like you do a dog. Most cats.
Okay. So that's.
Although you can, I would assume it would be toxic. All I've ever read is dogs. Sorry.
Yeah. No, that's okay. That's okay.
But yes, and some antibiotics, we are the guinea pigs for them and they are the guinea pigs for us.
Right.
They'll come out with an antibiotic. It might work great for a dog. For example, enrofloxacin, which is Baytril. People can't take that antibiotic. They take other fluoroquinolones, Cipro, anyway, which is ciprofloxacin. But we kind of learn. So there are a lot of combinations, like amoxicillin. The human version is the dog version, is the dog version is the human version, and the cat version.
Wow. So the best course of action then would be ask your vet.
Yeah.
Don't give something that you think, oh, it's fine for me, so it's probably fine for them.
Please call us and ask us.
Yeah.
I have clients call it. They'll ask 50 people.
And get 50 answers.
And I'll tell them, I'm just a phone call away. Please call.
That's great.
Even if you don't talk to me, the technician will ask me just call me.
It'll get back to you. So let's talk about pilling your animals. And I just gave you my little
I'm glad
scenario.
you mentioned that.
Yeah, because there's a million ways to do it. There's the pill shooters that you can shoot. There's some animals, some dogs and cats will just eat it up and they're fine with it. Some you have to shove it down their throat. So give us some quick tips or tricks on how to do that.
Well, we mentioned this earlier. When you have your puppies, when you first get especially when they're babies.
Yeah.
Start then. And I used to do this all the time. I would take a treat, a yummy treat, and I would open their mouth and put the yummy treat in. I didn't shove it all the way back. I didn't make them swallow it.
Okay.
I just got them used to me opening their mouth and putting something in. Open, put in. Sure would be nice to do that on your kittens and your puppies so that when they're 20 years old and you need to give them medication, they're okay with that.
How often should you do that? So if you just get a brand new kitten or a brand new puppy, once a week, once
a day.
Once a day.
Every
Do
other
that
day,
once okay.
Every now and then.
So whenever you're giving a treat, maybe the first treat you give them is you do it that way. And that kind of desensitizes them and gets them used to that activity.
And then when they go to the vet and the vet has to look in their mouth, they're okay with that as well.
Okay.
It's a lifesaver for my fingers. Look at their feet, mess with their toenails. And you were talking about pilling.
Mm-hmm.
So now lots of the medicines are taste tabs. But as you've discovered, tasty to you may not be tasty to you.
Correct.
So it is good to know how. I could actually demo on these guys if you want.
Oh, that'd be great.
So I tell people I'm right-handed, so I use my left hand on the face, and I pull their right behind their canine teeth. There's a little gap there, so you can. And you've got if you're firm and you have control of their head, then they can't bite you, and there's not a struggle, and it's done in one.
Okay.
You know, the more kind of aggressive you are with it, the faster it gets done, and everybody's happier.
Do you want to show us?
I'll show you.
Do you have a treat, or can I get you a treat?
I can just show you with nothing.
Okay.
My treats are in my bag. Come here, Scout. Or Ava, either one.
There we go.
So we're going to hold her face on the side of her. See her little gap here between her canine teeth?
Yep.
Now I'm going to do it with this hand and I just hold her mouth open, and then I take and then I push.
And she's fine.
Uh-huh.
You've been doing that with her since she was little.
Yeah.
Yeah. So one trick is teach them early.
Yes.
And the other trick is when you get their head,
don't let go.
Don't let go.
Mm-hmm.
And they kind of can't. I noticed even if she wanted to wriggle out, she's
Yeah.
like, hey, where's my treat?
Yeah. So, and it just.
Yeah, there it is.
Yeah. And I think people are a little timid. They're not used to. I've been doing it for so many years.
Yes.
They're not used to that, so they back off when the dog cries or whatever, and then
or runs away.
becomes
That
a
would be my thing. That kept happening to me is when I would do that. She would run away and then it was
never
over.
see her for the rest of the day.
Yep.
And then you put the pill in. If you don't put it far enough back, if you're not aggressive enough, if you get it in the very back of their mouth and in the middle, they're going to swallow it.
Okay.
If you get it off to the side, it's coming back.
It's coming back.
If you don't get far enough back, it's coming back. Now they've tasted it. And I don't know if you've tasted pills, but I don't know any of them that taste that great.
Yeah, so now you're really in for a struggle.
Yes. So the more you go for it,
Yep.
the
Be committed.
yes.
Okay.
Be brave, be bold.
Be brave, just like in life. Be brave and be bold. I love it.
And if you close their mouth and blow on their nose and rub on their, none of that works.
None of that works.
None of that works.
I've tried it, and I know
it
it didn't work
doesn't.
for me, but I thought I was doing it wrong,
No,
so it just doesn't
you
work.
have to get it far enough. And on a cat, their little tongue makes this little groove.
Yes.
That's the pill slide.
Oh.
If you can get it onto that slide, it'll go back. Also, butter sometimes help. And I do like the little shooter things.
Okay, so you do like the pill shooters.
Because cats are harder to get your finger down in there.
Yep.
And they're wigglier.
Yep.
So I think the pill shooter, and I've seen people and they're like, oh, I can't do that. It's
Yeah.
scary. It's soft.
Yeah.
It's not going to hurt them, especially if you're holding onto that head and you've got control of the situation. Then you just fall and you shoot it back into that pill slot. You're not on a cat. It's really, with a pill, it's really difficult to get it too far back.
Okay.
They've got their little laryngeal cartilages will slam shut. They've got really sensitive.
Yeah.
So you're not going to choke one.
Okay.
Now you can with liquid.
Okay.
Liquid is scarier. And
So the pill version, the
Mhm.
pill shooter is the way to go.
and I prefer pills to liquids on cats for that reason.
What about the liquids can you mix them in with their food? I mean, they're pretty smart, so
They'll never eat.
they'll never eat it. Okay.
Well, most of them won't.
What about the pill pockets, the pliable treats
Love
that you
them.
can? Okay, you love them, so
But
those are
they
good.
don't always work.
Right. Well,
They're
once they
cats.
figure out
And they're
once they
dogs.
figure out there's a treat,
Right.
not a treat in there. There's a pill in there. That's
Yes.
not going to work.
Even one of my dogs that was a pretty good eater was like, yeah. And then he stopped eating his food altogether because he knew
it was going to be
they're
in there.
smart.
They're smart.
They are.
They're
So
smarter
I
than we
would
give them
poke
credit
his
for.
pills down separately from a meal.
Yep.
It had nothing to do
Totally
with food.
separate.
And then he started eating again. I thought, okay, he's not, I thought he was a teenager at that point. So I thought, uh-oh, but it was fine. It was just, he didn't,
Yeah, he was smart.
Mhm.
Okay, so I've got a list of myths.
Okay,
So I've got
more
them here.
myths.
I'm going to just shoot them out and you tell me true or false.
Okay,
Cats bathe themselves.
true.
True. So if you're hearing that you should give your cat a bath, that's a no.
Only if they've got a dermatological issue, no.
Okay.
I don't bathe my cats.
Okay.
They take care of that themselves.
Cats are on a 30-second vomit cycle. They're always vomiting, and it's normal. Is that a myth?
No,
That's not normal. So if your
That is-
cat's throwing up, that's a sign something's
that
wrong.
is a sign something's wrong.
What about occasionally, like they'll have a hairball or something?
Occasional vomiting is okay.
Okay.
When it gets into, and I ask this question, are they vomiting once a day?
Yeah.
Once a week? Once a month? Once a month I'm okay with, even twice a month. More than that, is probably a dietary issue, an inflammatory bowel, some sort of allergy. And the problem with that is over time, those cats seem to develop lymphoma.
Okay.
So we want to address
You wanna
that,
know.
early, not late.
Okay. Once a dog is red flagged, they cannot be rehabbed. So if an animal bites, as an example, is how they get red flagged in a rescue or a shelter.
I would
They
have to
can't be
know
rehabbed.
the actual situation. But you and I just talked about this.
Yeah.
I have a dog that'll bite me. I mean, if I put my face in his face.
Yeah.
So what do I do?
Don't put your face in their face.
Good answer.
Yeah.
And so there are certain situations. She's not great with kids. My other one that would bite me was not great with kids.
So it's not that they can't be rehabbed. Sometimes it's just the scenario that they're in.
Yeah, I would have to know more about that particular dog.
Okay. Do cats always land on their feet?
Not always, but usually.
This is I'm asking it because of a personal. So I have like a landing,
Mhm.
and my cat, my boy cat, loves to go up there and taunt me from up there. Like he's gonna jump, I'm gonna jump, and my husband loves to be like, "Come on, Gordon, you can do it," and I'm panicking. What's a safe drop for them?
I would say not more than 10, 12 feet.
Okay,
That would make me nervous.
Are
Because
they
they can land on their feet and still break.
right.
They can break the fracture.
So he never has jumped. He's way smarter
good.
than we give him credit for. He does not jump. And I feel like they would know, right? They know what they can
They
gauge
do know.
successfully.
But
Okay.
that is called, we don't have that in Texas so much, but that's called high-rise syndrome, where the cats are on the balcony and
Yeah.
they either fall or jump off. And it's a lot of
try.
trauma.
Okay.
Yeah, and some of them don't survive that. So yes.
You should not have your dog be in your bed. I don't know what the myth is behind it, but is that a positive or a negative?
I think that's an individual. That's like
Individual choice.
Yeah.
No good or bad to it. Okay.
Mine, I have 4. I can't sleep with them.
Okay.
But the cats sleep up there, so
My cats sleep with me too.
I
Is
don't
it
think it's fair.
bad to let a dog lick your face?
My grandmother would say so, but I let mine do it all the
Okay.
time. don't think
Multiple
so.
dogs always have an alpha. So you have 4. Is there an alpha dog in your pack?
Probably.
Yeah.
Mhm.
Okay.
It's the little one, right?
Of course it is, right?
Mhm.
Do they switch off? Hi.
They can. With time, they can. As the alpha dog ages, sometimes he'll lose his status.
Okay. Cats are happiest as the only cat.
Mm-mm.
No, they want to have other cats in the house with them.
Depends on the cat. But I think cats they're social in a different way than dogs. And not all of them are, but yes, I think it's nice to have more than one cat. They keep each other company.
Are dogs actually colorblind?
Yes.
That's true.
Mhm.
Not a myth.
Mhm.
Myth busted. Okay. A dog's sense of smell is 10,000 times better than humans.
I know it's way more. I don't know the number.
Okay, but it is way more.
Oh, yes.
I was speaking to somebody that told me that the service dogs that sense the diabetes
Mhm.
episodes coming on, it's because of this, they smell in the saliva that it's off. And I
Maybe
find
so.
that to be
I'm-
so interesting.
They were testing them for COVID to turn them into COVID smelling dogs.
Wow.
They can snuff cancer. They know, and they can sense seizures. I don't think that's smell. I think that's something else.
different.
But yes,
Wow.
they've got powerful noses, unbelievably powerful noses.
Okay, and my final question for you, my final myth is, do dogs really hate cats?
No.
No.
No, these guys are good with cats.
Is that more of a breed or how they're brought up, or is that just
I
really
think it's-
something we've made up? Because you've always got the cartoons. When I was little, we had the
Yeah.
cartoons with Tom and Jerry, and then there was I don't know what the dog's name was, and they would all just constantly be chasing each other.
Right.
So we kind of taught people
Cats
that
and dogs can live in harmony just fine.
they can.
Yes.
Well, I love it, and you're doing it in real life.
I am. 3 cats that kind of rule the roost.
The cats rule the roost in your house, so that's
Mhm.
interesting. So you've got dogs and cats,
Hmm.
and the cats are running the house.
And the little dog that is the top dog, he gets along well with the cats too.
Well, power senses power.
Yeah,
They like
I
it.
think so.
They like it. Dr. Meg, it's been great
Thank
having
you. I
you. Thank
enjoyed
you
it.
so much. It
It
was
was
so great to
fun.
bust all these myths and learn so many fun things. Thanks for joining us today, guys. And remember, please adopt, don't shop.